Hello, everyone. Welcome to One Mind Brain Waves, where we talk with leaders in our community about who are making waves in the brain health space. Today's topic is the mental health fallout from the pandemic recession. Businesses across our country have been forced to close their doors for long periods of time, lay off many of their workers so they're operating short-staffed, and in some cases close their doors permanently, leaving many, many Americans out of work. This creates a tremendous economic uncertainty and instability in our nation, and is a source of great consternation and even mental health fallout for so many people. Today we have two public health experts who are going to discuss these issues and how they're affecting people's mental health across the country. And we'll also hear a wonderful song about persevering toward your dreams in spite of overwhelming obstacles. But first, I'm going to tell a quick story that illustrates the example of somebody who has persevered and gone through terrible economic instability with flying colors and emerged with a great mental resilience. And this is my grandfather. My grandfather, Pasquale Stagliano, was a member of what's been called the greatest generation, the generation that lived through World War II. And he immigrated to the United States when he was about 4 years old from Italy, as you might guess from his name. And he came of age around the time the Great Depression got underway in the United States. And he had difficulty finding work in New York where he lived. But he found that when he became an American citizen and he changed his name to Ray Staglin, he became much more able to find work. Now, these experiences and the ethnic discrimination that he faced taught him a great amount of grit and realism. Now, over the decades that followed, he met my grandmother and settled down to raise a family, and the self-reliance he had learned during the Depression enabled him to learn a whole new profession, giving up his work as a traveling musician, which he very much enjoyed, to raise a family with a stable job as a furniture construction upholsterer. And so he ultimately rose through more workplace discrimination to own his own business and succeed as a respected member of the community. So the respect he had for himself and for reality, I believe, were great assets for him in weathering that terrible economic challenges of the Great Depression and beyond. Joining us now is an artist whose songs explore contemporary social issues, from the meaning of freedom to economic hardships, to personal struggles, to even the stigma surrounding mental health. Singer and songwriter Nicole Stella, thanks so much for being on Brainwaves, and welcome.
Thank you, Brandon. Thank you so much.
Great. You were born and raised in Italy, classically trained as an opera singer, but you've always been drawn to American folk music and singers. What is it about that genre that inspires you so much?
So I think it all started with Joan Baez, because my father still has a very old vinyl with her music, and I started listening to that as a young kid. And I think the simplicity of the arrangements, like, some songs are just voice and guitar, but of course her voice is amazing, so that's already a lot. But just the simplicity of it, and at the same time the great storytelling behind those songs kind of really impressed me. So yeah, I think that's how it all got started with American folk music. Yeah, through Joan Baez.
That's great. I love Joan Baez, and I love folk music too. I like to play it on my guitar when I play. And but what draws me to it, kind of like you, do you find that you kind of feel like you get to know the singer really well because of the stories that they tell and kind of connect with them more than other genres?
Yes, definitely. And the other genre I feel the same connection with is probably rock music, because I'm a huge fan of rock bands too. But that actually came a bit earlier than folk music, because I think it was both, rock and roll is a bit more raw and kind of, you get what they're saying instantly, right? Because usually songs are simpler and stuff like that. But yeah, but I feel a huge connection with folk songwriters mostly. So that's how it all got started, I think.
That's amazing. That's great. So you've released albums in both languages, Italian and English, including a concept album that explores mental illness and the healing power of art. Can you please tell us a bit about that project and what you're trying to say?
Yeah, so that is a bit of a complex project because it's inspired by a woman who was committed to an asylum in the early 20th century, in the first half of the century. And so basically, I got fascinated by that kind of stories that actually very often were injustices, right? So when I write, I find it very interesting to talk about outsiders, people who don't really fit in, and so that was a perfect example. But I didn't want the album to be too gloomy. I wanted it to have hope, and I think the hope was art, music in particular, but art in general, because I think art has a huge healing power, and we can all experiment that. Like even if in our everyday moments of sadness, sometimes it happens. If we listen to a great song, if we read a book we particularly love, if we start drawing our emotions and stuff, we can really we feel better, I think. At least that works that works for me. And so yeah, so I thought, okay, that's the key. Like that's the hope I'm going to put in the album. That's the power of art, the healing power of art.
That's awesome. And I've experienced that too, but I'm glad you have that healing power in yourself and the art that you produce. And I think you spread that to others too in the art that you produce. And I think you're going to spread that to some of our viewers today when you sing your wonderful song. We'll get to that in just a moment. Yeah, thanks. So the song you're going to perform for us today, Less and Less, is about dreams and frustrations from your 2015 album, New Day. And how did you come to write it?
Okay, so the song was published in 2015, but actually I wrote it when I was 16, so it was about 2008, 2007. And yeah, I was in a music school, and my teacher at some point asked me what job my parents did, and I was like, well, I'm from a working class background mostly, and I come from a very small town where you don't get many chances to perform and to have like a connection with the industry. So that was my reality, and that still is at some time, sometimes. But and what she said was, well, this is going to be tricky for you because to become a professional musician, you need connections, you need to know people, you need help from your parents, you need money, blah blah blah. And so I think she wanted to warn me and avoid disappoint me later on in life. But in that moment, as a 16-year-old, it felt really harsh to hear that. And so I went back home and I wrote this song, Less and Less. And basically what I mean to say in that song is, okay, things can be tough, and it's okay to be aware of, how tough things can be if you come from a certain situation, or, even if everything's work out fine. I mean, sometimes life gets tough. That's how it is. But at the same time, you don't have to let yourself down. You have to keep, pushing, and you have to keep going ahead and trying to do your thing, and mostly live on your own terms. And so that's what I wanted to say in that song. And yeah, hopefully I managed to to give out the message. Hopefully. So that's it.
Wow, that sounds so powerful. I can't wait to hear your song and how you express that. Can you please play Less and Less for us?
Sure. There we go. Drops of rain in this bed, and some flowers in my head. Summer's late this year, and it carries all the fears away. The train's gonna leave, I'm not late, I'm here. Wish I could cry and not only hide. Old man and their stupid lies, their strange society and their paradise. A world written in black and white when there's no need of a mind. Breakest gods and breakest heavens that you can buy in temples. Breakest weapons and breakest words that you can buy in this world. New victims in an old class, you grow up and you care less. No flower flowers on your grass. You grow up and you're worth less and less. You're worth less and less. Dirty streets for your brain, and a ticket to dance in the rain. It is okay to walk in, but you're banned if you're free. The train's gonna leave, I'm not late, I'm here. I wish you could cry and not only hide. All men and their stupid lies, the strange society and their paradise. A world written in black and white when there's no need of a mind. Break us presidents in a break us place that you can buy by race. Break us weapons in break us words that you can buy in this world. New victims in an old class, you grow up and you care less. No flowers on your grass, you grow up and you're worth less and less. You're worth less and less. That's it.
Oh, wow.
Thank you, Brandon. Thank you.
Thank you, Nicole. God, I love that song. It's so poignant. It's so poignant. It reminds me of one of my favorite songs, which I have loved ever since I was a kid, which we were talking about before the show, My Hometown by Bruce Springsteen, which you also
Yeah.
do perform sometimes. And
Yes.
how there's this despair that people can feel if they feel like their lives aren't going to go somewhere and they aren't being taken seriously, or there's opportunity that might not be there. And but you've come so far since you were 16. You're performing now, and you're writing these amazingly beautiful songs, and you're performing on our show today on One Line Brainwave. So thank you so much so far and being with us.
Thank you so much for inviting me. Thanks a lot. It was a real pleasure.
Thank you so much. Well, appreciate you being on Brainwaves today, and I wish you the best in your music career. Hope to have you on again sometime.
Okay, thank you, Brandon. Thank you so much.
You're welcome. Take care. Here now to discuss the terrible economic turmoil facing the country and its ripple effects for people's mental health across the nation are two experts in public mental health. Dr. Andy Keller, President and CEO of the Meadows Mental Health Policy Institute, which is a organization that provides data-driven policy guidance to improve mental health services in the state of Texas. And also Dr. Jonathan Sherin. He is the Director of Mental Health Services Director of the Department of Mental Health for Los Angeles County in California. Gentlemen, thanks so much for being here and welcome to Brainwaves.
Great to be here.
Excellent, thank you. So Andy, let's start with you. So Texas has been hard hit by the pandemic in many ways, and your organization has released a report detailing the likely mental health effects of the pandemic recession, in particular related to unemployment. What has your research found there, and how is it seen that the pandemic is likely to affect people's mental health through economics?
Well, Brandon, thanks for having me here today. And I really was moved by your story about your grandfather, because I think, hardship like that and persevering through hardship is an important part of life. And there's lessons we can learn, from generations because this is something, it's never happened in my lifetime. I mean, but, I'm not part of a greatest generation, yet. Maybe we will be called that after we get through this, or some of us will. But, this is a terrible thing going on. It's really unprecedented. So, I think I think we all kind of understood that, we were coming to terms with it in March, April, kind of dawned on us. So, our team in April said, let's try to project, because we really saw that one of the things we felt moved national policy makers to maybe take things more seriously than they were some of the projections coming out of the UK and some of the other epidemiologists saying, look, we could have 2 million people die, or we could have, I think the final one was around 200,000 in the next year, which is sadly where it looks like we're going to be. So we try to do projections like that, not because, I think some people try to politicize it. I had several reporters say, so are you saying we shouldn't shut down, that we should, kind of keep the economy going to kind of not have people die from suicide or overdose? And we're like, no, we're just saying that if we do this, this is going to be an effect and we need to prepare. So what we did was it's hard to model everything. Some people said, well, the isolation, and the isolation actually I've probably not traveled 200,000 miles this year, which has been a huge good thing for me. Like, I've been around my family more. So some parts of this have actually made life easier. Some parts have made life harder. So we tried to model the unemployment, because we know there's a relationship between unemployment and what we sometimes call deaths of despair. So we did those correlations, and basically what it came down to was that for every 5% increase in unemployment that's sustained for a year, we would lose about 4,000 Americans, about 300 Texans, 375 Californians to die from suicide, more than baseline, and about 5,500 Americans, about just over 400, just over 650, 400 Texans, 650 Californians to drug overdoses. So, and that's on top of the 120,000 a year we were losing before. So we had this epidemic before of suicide, deaths from suicide, deaths from overdose, that's gotten worse. And unfortunately, what we've seen, in the data since then, is that symptoms of depression are up fourfold, using pretty objective measures. About twice as many people are seriously considering suicide in this last month that they looked at compared to a year prior. So unfortunately, we weren't exactly, you can never be exactly right. You hope you're wrong when you make projections like this, but it really does seem like we're seeing this happen, and it's going to persist. It's not going to go away. It's like PTSD. You have the war, you have the effects, you come back home, but the effects still, a lot of broken lives, a lot of things going to be hard to put back together because of the effects of this pandemic.
Yeah, it's staggering to think of those numbers, that increase in suicide and drug overdoses due to the unemployment. Are there certain populations that are most at risk due to the economic downturn, due to the pandemic, that you can pinpoint?
Yeah, it's interesting. So there's baseline risks of death from suicide, death from overdose that are different among different groups. Like, the highest risk group for death from suicide are American Indian and Alaska Native people. Followed closely by my demographic, white guys in their 50s. We're a big group to die by suicide. But even, groups like African American women, who as a whole have much lower mortality risk from that. The mortality risk has doubled in the last 5 years. So, and I think we see this in women in generally, that many of the risks are increasing for reasons we really don't fully understand. We see our youth suicide rates going up. And then with overdose, a lot of people focus on opioids, but that affects different populations. So, like, if we look at our more urban areas, a lot of people are still dying from cocaine overdoses. Or if we look at some of our rural areas, it's methamphetamine. So, and then also too, I think we have to look at what is a death of despair. It's kind of classically defined as suicide or overdose, but I really think the unrest we're seeing around sort of an increased awareness of racial injustice is revealing that people dying from shootings, dying from other interactions, not just interactions with police, which is horrible, but also interactions with violence. There's a lot of tragic consequences that are all worse. Gun violence, way worse than a year ago. Deaths from murder, way worse than a year ago. So, I think we have to think about it in terms of the risks that are to specific individuals and communities.
Definitely, and it seems like our society is kind of moving a bit out of control in many ways, and things are getting challenging to deal with for so many people. And it's important to think about what the solutions might be. And we'll get to that in just a few minutes here, but thanks for those numbers, those insights. And John, moving to you, how does this resonate with you? California has been especially hard hit by the pandemic, like Texas, and double-digit unemployment numbers in California have been seen. What are you seeing there on the ground in Los Angeles?
Well, I would echo, all of the comments, and of course we don't do epidemiology. We really see things in real time, and we try to respond. But clearly, there's a confluence of factors that is taxing the mental health and well-being of, the vast majority of our population. I would, as an initial comment, say that I think it's shining a bright light on the issue of inequity in our society, in terms of who's being hardest hit, who's losing their jobs, who's losing their businesses. And I would say that the divide between the haves and have-nots is becoming very stark. Issues of broken routines, isolation, fear of becoming infected, fear of infecting others, are an ongoing challenge. And I would say that those phenomena are impacting certainly the population broadly, but in particular what we would call front lines. And of course, my department, which is a massive department, has a lot of frontline workers. But I think we're getting a sense of what frontline work means, because it's not just in the healthcare field. I mean, of course, healthcare workers have, increased exposure because they're with people who are sick. But there are those who are, working in gas stations, those who are working in our, in our markets, and really more broadly who are being impacted. And of course, those in congregate settings, nursing homes, boarding cares, and even in hospitals are suffering significantly. I have a different take on the whole impact of the economic downturn, which is that my department relies upon tax revenue. So you can imagine that the different funding streams are getting decimated. We have less money to work on improving access and do prevention-oriented interventions. We have less funding to just simply deliver care. We have a workforce which has been, largely redeployed to home, and we've had to shift dramatically in terms of how they interact with our patients. Our crisis system, which is really in place to help folks who are falling out of community to stabilize and to get back into the community. We've had to re-engineer all of that work, and we also don't simply have the funding to be as robust as we need to. How do we support a system which is already significantly under-resourced? We don't have enough open residential beds. We don't have enough acute psychiatry beds. And this is really, really forcing us to do a lot more with a lot less. And then you add to that issues of people in the streets. We have about 60,000 homeless in Los Angeles County. And I would say of that number, probably 10% have severe persistent mental illness, which is really kind of our core work. But the vast majority suffer from trauma and certainly are impacted by this pandemic. We're doing everything we can to put people into shelter. But of course, when you put people into congregate settings, you're increasing their risk. And I don't need to tell you about folks in the jails and the prisons. This is a big, big issue. But the loss of funding, the increased demand for care, really kind of generate an equation that's difficult to deal with. We have massively increased our use of telehealth. We've gone from 20% telehealth visits to 80% telehealth visits. We've increased the number of people that we've seen. We've dramatically decreased our no-show rates. That's something that, I think we are learning about, but so are many, many jurisdictions, and not just in mental health. And as I say, when I go to Sacramento, and I'm not always popular there, we need funding for that kind of service, not just in the context of the pandemic, but long-term. There's a sense that, we'll do a favor to these jurisdictions and allow them to get paid to do telehealth. Well, hey guys, we're kind of reinventing the system to make it more efficient, to increase customer satisfaction, to increase penetration, decrease wait times, travel times, et cetera, et cetera. So can you please fund us long-term for those types of modalities. I mean, I could go on and on. I will tell you that we're pushing out tons and tons of messaging, messaging that's hopeful, but also messaging for how to get help. We've tripled the size of our call center capacity, and our numbers have almost doubled over the past 5 months. We're also making available those telehealth and well-being line type services, not just for our consumers, but more broadly, and to the entire county family. We have about 110,000 employees in Los Angeles County, and we're getting a lot of those people access to our services and to our helpline because they need it, because they're under significant duress. You know, we're also in the process right now of pushing out, I like to think of it as kind of stimulus packages into the communities and into those communities that are suffering the most from disparities, to help people get trained and actually hired as extensions of the department in their communities, many of whom have lost their jobs, to make sure that people know what's going on and to help navigate what are very complex systems. You know, so there are many things that we're kind of pushing operationally that we might not have. I would also say that the Board of Supervisors, we have 5 of them in this county, and that's kind of the California way. They are really helping us. They're stepping up and kind of going after red tape with us. I mean, I've spent my career in the VA, you want to talk about bureaucracies, but also LA County, just kind of taking out red tape, because the bottom line here is that as we have less resource to deal with, we need to be more efficient with the resource we get. So you can't spend half your day as a clinician filling out forms, doing medical records that really steal not just your time, but at some level, you know, your heart, your soul, because you didn't come into the business to take care of auditors. You came in the business to take care of people who are suffering. And we really, really have to think about that. I mean, I'll just one comment and then I'll stop. I've worked with 3 different secretaries in the VA, and I asked them, hey, in the nonprofit world, you know, a good direct service nonprofit who is assessed by Charity Navigator is supposed to spend about 80 cents on the dollar direct service. What is it in the VA? And what I told them, I thought it was between a dime and a quarter. And I would say in LA County, which I love, and I love my bosses, I do tend to speak out, it's probably 50 cents. So how do we go after that? How do we transform and innovate our process, our bureaucracy, so it can be more efficient and it can focus on the trenches, taking care of the people who are delivering the service and the people who are receiving the service, and not focusing on our systems and an over-audited compliance mindset.
Wow, John, my heart goes out to you. You're experiencing so much trauma, not only in the community around you, but within your department and within the community, working to help the people who are in the community. I really admire the measures you're taking to maximize the efficiency of your department, to reach as many people as possible, not only through telehealth, but also through sort of deputizing people in the community to help others, you know, within their local areas. I think that's brilliant. That's a really great measure you're taking there. So I really, kudos to you. Hats off to you. If I had a hat on, I'd take it off. Thank you, John. Andy, pivoting to you for a moment, and this is directly relevant to what John was just saying. You know, at the same time that services and access to care are most needed, these cost-cutting measures are taking place. I think that's all around the country, not just in LA. This is a big concern. How do you see this as a concern, and what can be done to elsewhere to deal with it?
Yeah, well, I want to applaud Jonathan and the other providers that have made this historic, rapid shift to telehealth. I mean, it is impressive what has happened across this country. And I think, you know, when the story is told about what's happened over the last 6 months, one of the bright spots and the heroes that are going to be shown are the you know, tens of thousands of providers that have said, you know, I'm going to try this and I'm going to do it, including people who are very uncomfortable doing it. And it's been fantastic. You know, one of our university clinics went from 80% productivity on their physicians' time, which is actually pretty good, to 130%. I mean, you know, because they had no shows, and they were able to really, and there's parts of rural Texas that have better access to healthcare than they've ever had, because of exactly what Jonathan said, that we've liberalized these laws where we thought, so, well, it's better to not allow someone to get a visit on a telephone because we can't guarantee that'll have the same quality as face-to-face. It's best that they just have nothing, because we wouldn't want to pay for something that, might not be as good as a face-to-face. So, I mean, I think we need to make common cause. I think, Maggie and the team at the Steinberg Institute, I mean, I think there's a lot of people across the country who we need to come together both nationally, and there's good federal legislation, the bipartisan federalization there once we get out of whatever this thing is we're doing right now, I guess, called an election. And then at the state level, we have to make common cause to not lose these gains, because they are real gains. That being said, one person used the example of a tsunami, that when a tsunami happens, the water pulls out of the bay before the tsunami hits. And that's what's happened. I mean, a lot of our providers have not had, certainly during March, April, before they pivoted, the kind of revenue that they had. We lost a lot of revenue, and we have way more demand, like Jonathan said. And so, I do think the federal efforts that stalled around getting additional provider relief, state relief, they need to go forward. I mean, we're not going to be able to, we have to have that relief going forward. And there is bipartisan consensus. The HEROES Act in the House had $3 billion. The HEALS Act in the Senate had $4.5 billion for mental health. And then, there's, I think everybody wants to do some level of state support. And hopefully, once again, we get out of this election thing, that'll move forward too. So I think those are the things I guess I think most about, Brandon. And then I guess the other thing, and then Jonathan said this, is awareness, because I just think people were not paying attention to this epidemic that was going on before. I mean, people were generally aware, yeah, suicide rates are going up, and and then our folks with homelessness, folks with psychosis stuck in our jails. I mean, attention to this and the fact that we can do something about this, and we just need the will and then the resources behind it.
So there is a silver lining. It seems like if people are getting more aware, there's a possibility, if people mobilize, if people get engaged with advocacy, maybe things can change at the governmental level to improve funding for services all throughout our country. And I hope folks out there will bear that in mind and perhaps take action. As you mentioned, both John and Andy, telehealth is a really important advance, and the distribution of it more broadly is an important advance to help more people, especially during this time. But what about people who don't have a computer, who maybe have lost their job or disenfranchised, maybe they're homeless, they don't have access to a phone or a computer? John, how does your department help those folks?
It's a great question, and it's quite difficult. We have a very robust street outreach team, and we have a crisis response division that is expanding. Both of those things are expanding significantly, certainly since I arrived, because we need to recognize that access is a fundamental barrier, and access means lots of different things. So we're pushing resources out into the community. I mean, I myself still do street psychiatry. I go out into Skid Row and into Hollywood. I try to go once a week, although that's difficult given my role, to kind of stay in tune with the mission, but also to kind of lead with example, because there are, as you can imagine, a lot of clinicians, particularly those who are at risk, who are reluctant. Those are kind of important, meat and potato type efforts that cannot stop. In LA, I'm not sure of the number currently, but it's a pretty big number. I think we probably put about 10 to 15,000 homeless people at risk into housing, mostly in hotels, but in some congregate settings. And we're leveraging that. We have clinicians who 7 days a week are going in to make sure that those who are vulnerable, have not had a stable place to live, have access to mental health services and to substance use services, many of whom never really have. So there are many, many silver linings, as you point out, Brandon. And I would say also that, in LA County, the Board of Supervisors is very focused on the fact that a lot of people don't have access to technology. Just this last week, there was a significant investment in those neighborhoods where kids don't have Wi-Fi nor devices, and we're going to stand that up. We're building infrastructure in the most vulnerable communities to help, recognizing the impact of telehealth, but also access to virtual care. There are many tools, as you know, and I know, Brandon, you do in particular, for virtual care, and there are a lot of different programs in the state of California. Over the past year, a couple of years actually, the counties have invested in a number of technology-based solutions, and they're slow for us as government agencies to get up and running. But those are things that we're pushing out broadly, and we're finding that people who can get access to meditation, even to cognitive behavioral type treatments virtually at their leisure, benefit. So these are things that we really have to recognize as a society are opportunities, and that we can help so many more people if we just kind of push the envelope.
Yeah, that's brilliant to think about using those technologies that are not so widely distributed in a care setting yet, but are getting more that way. And it's great that program, which is called Help at Hand, all throughout California, is distributing these mental health technologies throughout the counties in California. I think they're like 20 or so counties participating in that now. It's about half of California, which is pretty amazing.
Yeah, absolutely.
Yeah, I hope more people can access that. So we're talking today with two experts in public mental health about the mental health fallout from the pandemic recession. And we're talking with CEO of the Meadows Mental Health Policy Institute, Andy Keller, and Dr. Jonathan Sherin, Director of the Los Angeles County Department of Mental Health. And viewers, if you have any questions for our guests, please feel free to ask them anytime. And in your comments, please also, if you don't mind, list any stories you might have about how you and your community are dealing with this, the mental health fallout from the pandemic economy. And if you'd like to, let us know where you're from. And if you have any, if you feel like this information is helping you and could help others that you know, please share this webcast with them. Thanks. So, Andy, back to you. Going forward, we've talked about silver linings here and the help that advocacy could provide. Going forward, what could policymakers and health systems do to rise to meet this overwhelming and unprecedented need for mental health services all across our nation due to the pandemic and the economy?
Well, it's a couple things. One is to take some of the lessons that Jonathan was just describing. One of my favorite ones is, it's one, just, in Texas, we're kind of used to y'all in California, like doing cool stuff because you got that, those taxes and those other things y'all get to do stuff with. But in Texas, we used our coronavirus relief funds to do the same things. We went and got hotels. We have so many fewer, we have more homeless people because of the economy, but we have fewer unhoused homeless people because we have used hotels, and we have stood up, and again, it kind of catalyzed people's will. And I think some of those motivations, frankly, were probably not so great, I think trying to control and whatnot, but people got housing. And so we learned that with resources, we can house people, I think that's really important. The other thing I think is, we need to really look at some of these laws that in the technical policy world that I work in, we call stupid. So one of them is the limitation that we put on primary care providers saying, y'all go ahead and prescribe as much pain relief opioids as you want, but you can only prescribe buprenorphine to cure a subset of those folks. It just makes no sense. So we just released a paper with the Steinberg Institute back in August where we said, let's say we had universal access to medication-assisted treatment, to buprenorphine, naltrexone. If we had universal access, what would happen to our deaths from opioids? And the reality is they would go down by half, 24,000 deaths from opioid from opioid disorders could be prevented a year. And, you know, I mean, not only should they ease the restrictions, they probably should drop the stuff from airplanes so that people could have access. And I'm actually kind of not joking. I mean, programs where we've, you know, emergency rooms where we're trying to give people 2 weeks supply of buprenorphine, and we hope they come back. And, you know, some of hard-nosed people will say, well, they're just going to use that to manage their withdrawal so they can continue to use. I'm like, yes, they will use that to manage their withdrawal symptoms. And isn't that like a good thing? Do we really want them suffering withdrawal? I mean, you know, so I think that's a big one. And I think the other one we really have to look at is how maybe we quit intervening at the time of crisis. Maybe we do what we've done with every other disease and try to intervene when the symptoms happen. I mean, my favorite examples, you know, my grandpa had his heart disease diagnosed when he had a heart attack, and they put him on egg beaters when he got home from the hospital after he got out of a coma. They started haranguing me about my cholesterol issues when I was 30. And so that transition where we identify people in primary care, pediatric primary care in particular, and we get ahead of these disorders is what we need to do. And of course, we're going to have people that still have severe needs, but then we'll be able to have our workforce more focused on that rather than the people who maybe could have had their needs met 8 years before when they were more moderate and instead now are, you know, in a much worse situation. So, you know, I think those are the lessons that I hope we take from this. And I think, you know, and they're the same things we're using with COVID. How are we managing COVID? We're detecting it and we're intervening quickly. So let's detect depression, let's detect psychosis, and let's intervene quickly. I'm just hoping we can just, you know, have people learn from this, including us in the industry, because we have to learn these lessons, because a lot of times we're the ones advocating for these restrictions. So because we somehow think that's better. So those are the main things I think we should focus on. Wow. Yeah, there's so much that can be done to improve things, and I'm all for the earlier intervention for serious mental illnesses, or to prevent them from coming into play for people's lives, and to keep people healthy, you know, so they don't have to lose access to their relationships and their jobs and their you know, everything that matters to them in their lives. It happens to so many people. It's great people are waking up to notice these things with the pandemic, so that action can be taken. You know, John, there have been a lot of trauma that has taken place during the pandemic. And what do you see as the long-lasting psychological effects, and both for California and beyond? And what does recovery look like?
Well, those are tough questions. You know, I think it was Tom Insel that talked about the tidal wave that is, you know, upon our field. And, you know, there are many who have studied post-traumatic stress disorder. There are some, including General Corelli, who prefer to talk about the term post-traumatic stress injury. But really, we need to start thinking about what does post-traumatic growth look like. You know, in the context of challenge, there are opportunities for people to grow. I'm speaking to kids and superintendents all the time, and what I'm saying to them, and I truly believe, is, you know, what are the lessons learned here, and how can you help us engineer the future? People need purpose. They need to, as our routines kind of, you know, are disrupted, we need to build new ones. We need to recognize that we still have agency, and that agency can be, you know, can be applied to, you know, inventing the future. You can't underestimate it. I mean, you always talk about it, Brandon, and I do too. And that is that we're very focused on medical model type approaches. And I mean, I'm a psychiatrist and I'm a neurobiologist, but I would get in front of the argument and say that, you know, people in life, they need other people, they need a place to live, and they need purpose. And those things are critical. There are many other tools. People need therapy. People need, you know, medications. Those are important tools, but we have to think more holistically about individual folks, what keeps them afloat, what gives them, you know, light and hope. And those are fundamental principles of recovery. They're not going to change. And what I would say is that as things are disrupted. And as we see these challenges, we have a whole scope of new approaches that have to be identified. They have to be invented. And that, if you look across the population, really will, I'd like to think, bring out inspiration in individual people and individual neighborhoods and communities. And in the process of doing that, we will recover and we will be stronger. One of the things that I want to say that I was about to say before, but I feel like I'm talking too much, relates to the I would say the private sector, but also the public sector in terms of the infrastructure that exists. My department, I have about 6,000 staff. I've got tons of facilities. There are many, many other governmental agencies that have all of these buildings. There are these huge corporations that have, massive, massive structures. We've got malls, we've got restaurants. Many of them are they're going to become obsolete. So as they become obsolete, and I do think there's policy implications here, and I'd like to hear my fellow panelists talk about this. These are potential solutions to the housing problem, to the homeless problem. There, in LA County, it's estimated that we are 500,000 units short. 500,000. And we, in the Department of Mental Health are asked to sign checks to pay $500,000 for a unit of permanent supportive housing that's going to take 3 years to build. And that doesn't include the services. So what are we doing as we have all this infrastructure that's going to emerge to say its utility is no longer putting people in cubicles who have to travel 2 hours in traffic every day when we can do telehealth. We can expand our hours to maximize the amount of space and go through the weekend in the new future that we all need to invent, and create thousands, tens of thousands, hundreds of thousands of housing units across this country. So I that's a challenge to the government. It's a challenge to the private sector, and corporations who make a tremendous amount of money and are reinventing their business models need to play. They need to recognize that their well-being and their future depends upon the overall well-being of our entire society, and that none of us is well until all of us are well, and pay it forward by making that infrastructure available to those who have suffered from all kinds of things, whether it's the pandemic that's infectious or the pandemic of structural racism, and help us engineer the future.
That is brilliant. You're such an innovative thinker, and seeing these opportunities that most people would not even notice. And not only that, you're an inspired and inspirational leader working to empower people to take action to not only help others, but thus find purpose in their own lives, help them too. I really admire your work, John. Thanks for all what you're doing. So we'll wrap up in just a moment here with words of hope. Andy and then John, what words of hope do you have for those who are struggling with the mental health fallout from the pandemic right now? And what can you say to them to help them have hope? Briefly, please.
Well, I mean, actually, I'm going to change what I was going to say, because what Jonathan said earlier, I thought was so moving. Trauma is a human thing, but enduring trauma is something we can do as humans. And I think, the whole construct of moral injury, really, as if our sense of morality, our sense of like, there aren't people in this together with us, if we've had past traumas that have caused us to doubt that, that's really where we get caught up. And that's where we get stuck with depression, with substance use, with post-traumatic stress symptoms. And it's really coming together, not just to like help and heal, but to like kind of help restore that sense of kind of a moral place. And I think to help people feel like, we're in this together and we're here with you. And I think we just need to be less afraid. I can't tell you how many people ask me, this person's, my loved one is suffering suicide. Should I ask them? And I'm like, yeah, you should ask them. Don't leave people alone. I don't know if I can do something. Yeah, well, don't leave them alone, because maybe both of you not knowing what to do together is better than that person being alone. So I think that's to me what I've seen happen over and over again. And I think that people have more of a heart for that now. I think we've all have a heart that's more ready for that, I hope.
That's heartwarming to hear. People are moving to be with each other And I hope more people will do that. I have to find, I have to be intentional about reaching out to people who I think are in need. And I'm lucky to live a relatively comfortable life during the pandemic, but I make it a point to talk to those who might not be doing as well. And it means a lot to me to do that. And I hope it does to them too. John, what about words of hope you have for those in the community?
Well, I mean, I think Andy hit it on the head, and I do believe we see examples of this. We talk about deaths of despair, and then I often talk about the other LOL, which is the lethality of loneliness. Isolation in and of itself is a very, very destructive process, and that it is connectedness that will save us. As we face the pandemic, we have to recognize that we have a responsibility to ourselves and each other to wear masks, to not go into crowded places indoors, to wash our hands. That's an expression of love, and it's an expression of connectedness and caring about others. And Lord knows that the disparities and the impact of racism and the trauma it begets is all about other. We need to be inclusive. We have to be connected. We have to recognize that our problems are collective, our solutions are collective. And I think those are big time memos right now for all of us around the world. So I mean, I'd like to think that when there's a global pandemic, that the World Health Organization has a role. That we have to think about the overall collective and how we live interdependent lives. I mean, for individual groups of people who have accumulated resource for periods of time, there's a sense that you can kind of live in isolation. But long term, the well-being of our species depends upon our connectedness. And I think everyone has to recognize that in their own life in a really fundamental way. And just the last thing I'll say is that when the pandemic hit, I often, and it was a new normal, and there was a certain excitement. I saw lots and lots of people in the street who would stop, and it still happens, and smile at somebody and recognize somebody and give them their space and let them walk by, as opposed to not recognizing them, maybe bumping into each other or getting each other's space. And that being apart is so about being together and recognizing that other person, that other sentient being. We have to figure out how to operationalize that and incentivize it, I would say, in all of our lives.
Yeah, it's so liberating to recognize the reality of other people around us and all throughout our world and our society. And it's not just all about us as insular human beings, but there's everybody else, and it's important in their own unique, special way. Liberates me when I think about that too. Thank you for those words of hope, John. Thank you, Andy, for your words of hope and all your insights today. Viewers, if you would like to ask any further questions, feel free to log on to onemind.org/brainwaves. Thank you very much for watching and participating today. Andy, John, thanks so much and take care.
You bet.
Thank you, Brandon.
Thank you.
Every day trying to find the strength. I just want things to go back to normal.
Science is racing to find treatments for the virus. Vaccines are on the horizon.
I don't know what to do.
But what about the mental health research needed to sustain our lives during and after the crisis? OneMind is funding the science to revolutionize treatments and provide hope. OneMind, accelerating brain health for all. Help us fund new treatments at onemind.org.